This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice.
So let's talk some of these strategies. Number one, I want to encourage you to assign a dedicated hygiene scheduling coordinator. One of your business team members need to be the dedicated hygiene scheduling coordinator. Now, oftentimes, if your office has multiple business office or front office team members, I say, well, we all do that. Naren, what happens when they all do it?
Nobody's doing it.
Nobody's doing it. And I don't mean that's not meant to be mean or not meant to be cynical, but everybody assumes everybody else is doing it. It doesn't happen. So I want you to assign one. We have a hygiene schedule. We teach our clients. I want one. Now, it doesn't mean they have to do it. Like I'm thinking of a client that has 3 business team members. All 3 of them can make hygiene appointments. All 3 of them can make doctor appointments. All 3 of them can collect over-the-counter payment. But we have a hygiene scheduling coordinator that is responsible for those metrics in hygiene.
Right. The 4 metrics you outlined, right?
Right, which leads me to the next strategy. Share those metrics with your hygiene scheduling coordinator. He or she can't help you get there if they don't know where there is. Imagine they're a pilot taking off and they don't have a flight plan. Where's the plane going to go? Wherever they want, wherever it wants. You got to give the hygiene scheduling coordinator a flight plan. And it's those 4 metrics, Now, this leads me to the third recommendation. Consider an individual bonus for your hygiene scheduling coordinator. And I would suggest one very specific one because it's easy to do and it results. If you do this one, the others will happen. It's the 92% filled hygiene appointment goal. So here's what we teach our clients to do. And you can use whatever dollar amount you like that fits your budget. I'm going to suggest the number that we most routinely see, but you're welcome to plug the number in with whatever your budget works for and whatever you feel comfortable with. So we bonus the hygiene scheduling coordinator if at the end of the month they're at 92% or more filled, kept appointments of the available hygiene appointments. So Naren, let's get real granular about this. If the office had 100 available hygiene appointments for the month, I'm just picking a round number, 100. If 92 or more patients filled those, were kept appointments for those 100 appointments, she's going to get a bonus. And the dollar amount we suggest is $250. Now, we do a second level. If she gets to 95% or above, we double the bonus to $500 a month. Now, if a doctor's sitting there thinking, wait a minute, I don't know if I can afford that. That's if they did that every month, that's $6,000 for the year. I don't know if I can do that. Let me help you look at this a different way. The average hygiene appointment in the United States is worth about $150. And that includes the pro fee, the exams, the x-rays. Some will be worth more than that, but that's a conservative number, at least $150. So if we fill some open hygiene appointments, how many more butts in the seats do I have to do? If every appointment's worth $150, how many more, Naren, do I have to do to pay her $250?
2.
Not even. It's like one and
something. Yeah, 1
and 3/4.
Yeah, exactly.
How about $500 for the double bonus? So do the quick math on that. How many more do I have to fill?
3 1/4.
Yeah, at 4, we're there.
Yeah, exactly.
And the reality is when you look at your numbers, they're not filling 2 or 3 to get to those numbers. They're adding another 15, 20, 30 appointments to make those numbers. So it pays for itself. This is where the bonus really works like I like it to, which is where it aligns the goal of the doctor with the goal of our team member. So strategy number 3, consider that. And hey, I'd be respectful if for whatever reason you didn't want to do that, but I will tell you, we see it working. And Naren, you get to see it in our mutual clients.
Yeah.
Would you independently corroborate that what I'm telling you?
100%. I mean, just to kind of something that you taught me is you cap the employee expenses, the team expenses at 28%. So you are okay with giving up to 20% of the extra money to the team as a bonus. So in this case, they get an extra 30% per patients, and they only need 3.25 to make it work, meaning to cover the extra bonus. So they're getting almost 9 times what they paid the scheduling coordinator, the hygiene scheduling coordinator. So not only does the hygienist is winning, but the doctor is winning. Everybody's winning. So this is awesome.
Now let me keep going. Fourth strategy. I want, if you aren't already doing this, I want you to embrace technology to reactivate past due hygiene patients. Use email, use text. You in some systems have auto phone messages. That can be done in an automated way. I know Solution Reach is one of those systems that can do that. Weave, we use Weave as our, disclosure, we use Weave as our technology as our patient communication tool. It's our phone system, but it's also the way for us to communicate with our patients. And of course we can communicate by phone, by text message, by email. But make sure you use that, because now we can become very efficient. One more piece of technology that I would encourage you to take a look at is real-time scheduling. We use Local Med for that. There's others. In fairness, there's other systems, but that's where we could send a link in the email or in the text. So you can either call us and make your appointment like you always have, or you can just click on this link. This works especially well for hygiene appointments, because hygiene appointments are pretty straightforward. Doctor appointments are much more complicated because of the variance in the time and procedures and so on. So you could certainly use real-time appointment scheduling for doctor side, but you don't want to start there. You want to start with hygiene, get your arms around it. And I'll simply tell you my satisfaction and happiness in working with Local Med. And again, to be fair, there are others, but use some kind of technology, because it's another way to get very efficient. So that's the last tip, is create a system to reach out to every past due hygiene patient once a month until they either make an appointment or they tell you to quit pestering. And I'm telling you, if you do it right in a spirit of helpfulness, they're not going to say quit pestering me, because they're going to say, they might say, I'm really busy right now and I'm distracted, but thank you so much for reaching out, and they appreciate it. So those are the 5 strategies to use.
One that provides personal, professional, and financial satisfaction.